Okay. With RTF training coming up at the end of June and some of the RTF drills we may be participating in for the rest of the year, I wanted to make a quick video where we just go over all of our RTF equipment. Just a quick reminder of what we carry, why we carry it, and what it's for. So we'll start with the vest. All of the vests are held in these black carriers. We actually have two different sizes, a taller one and a shorter one. The way to tell the difference is to count the MOLLE straps. These MOLLE straps are where you would attach any number of accessories to. But if it has the 5 MOLLE straps, it's the shorter vest. The taller MOLLE straps have 6 rows. Also, each vest should have what's called an IFAK, or an individual first aid kit. The purpose of the IFAK is only for the wearer. So if any of us were to be injured during an incident, all of the equipment for us should come out of our IFAK. It's just a way to guarantee that we always have one of everything available to us, if any of us should be injured. With regards to these ballistic helmets, they obviously offer great protection, but one of the, I guess, complaints or the issues is going to be the way they adjust. They're made to be infinitely adjustable to fit any number of people, but that does result in there being a bunch of straps and a bunch of buckles. So one piece of advice, if you were to have to wear this for an incident, whether it be a warrant or anything like that, take a few extra seconds, make sure this is comfortable. Obviously you're going to have to wear it for the duration of the incident, and there's a lot of ways to adjust it, but take that time to make it a little bit more comfortable for you, maybe while you're in staging or whatever. Moving on to the bag, this was a simple triage system that we had used in the past. It's still a viable option, but one thing you'll find is it does become a little cumbersome once these are loose. But it's a tool for the toolbox if you want to use them. We have the 4 different colors. In the past, the way we've done this would be doing things like tying it around the victim's ankle or wrist. Is just a way to mark them for future companies. Obviously, we do still have the older style triage tags, and those are great. There's a lot of room for information, which could be useful in the CCP or later on in the incident, but obviously they are also a little bit cumbersome. So there's more than one option when it comes to triage, whether you use the tape or the tags. It's kind of up to you, but just know that we have it. Moving on to the med bag, obviously we have the disposable litter on the outside. And yes, it's disposable, but it's definitely going to be good for multiple patients. Remember, in these types of incidents, whether you're assigned to be a triage RTF or to a transport RTF, there's a good chance that we're all going to be moving multiple victims. So don't just leave your litter if you can help it. Whenever you get your patient to wherever they're going, be it an ambulance or a CCP, try and bring your litter with you. Inside the bag, all the different areas are marked. Just want to hit on a couple things. We do keep a marker in the bag. That's for marking the tourniquets if we do use them. That's in a perfect world. If you don't have time, absolutely fine. We have 2 bandaging sections and an airway section, and then tourniquets around the outside. With regards to tourniquets, there are 2 different types within the department, rat and cat. Cat is overwhelmingly the type that you'll see our police officers carry. In my opinion, it's probably the most friendly, easy one to use. Just some reminders when it comes to using a tourniquet. Always go high and tight. If it hurts, it works. You can use 2 tourniquets, but make sure they're pointing in the opposite direction. When we talk about the cat style tourniquet, we use this red mark to indicate that it should go towards the center line of the body. That only applies for self-application, right? So if you are injured, you've been shot, whatever, and you were to apply it to yourself, you would want to make sure that this red tab pulls towards the center, just so you can get a better pull. When it comes to applying it to a victim, to a patient, it really doesn't matter which direction you go. And again, the only time it matters is if you had to use 2 tourniquets, you would want them to point in the opposite direction. The 2 types of tourniquets we have at the department are the cat style, which I just talked about, and also the soft style tourniquet. Those are the ones that have the metal triangles that the windlass attaches to. They're not the best, in my opinion. They're not the most user-friendly, but again, we do still have them. They get the job done if necessary. Some other equipment, we have our R's needles for decompression. Just remember that these are hair larger and a hair longer than a traditional angio, and that's why we use these. They do have an expiration date, but just like every other angio, they're going to be useful long after that. Inside the airway bag, we have the high-fin chest seals. There's multiple different brands. Most now should all be this high-fin style. Remember, it can be used to treat up to 6 penetrating injuries. Reason being, you have the 2 seals themselves, the clear plastic that they come on, and both sides of the packaging. And again, this is for any sort of sucking chest wound, penetrating injury, gunshot wound to the torso. You're going to want to use the high-fin seals. So in addition to the chest seals, we have the quick clot. Remember, this is designed to fill up a large wound, maybe an exit wound from a bullet or an explosion, something like that. And think of this just like packing a rope bag, right? If you just hold the square in place and place it into the wound, you're going to have a lot of void spaces that are still going to fill up with blood. But if you feed it into the wound little by little, it will fill up all those void spaces, and then hopefully the additional chemical additive will help stop the bleeding. We have the blue line in all of these. Remember, that just makes them show up on an X-ray. Because again, with a major injury like that, the surgeon's going to want to be able to see the extent of the injury and make sure that all of this is removed before they close the patient up. Israeli bandages, we have a couple different varieties. They all work effectively the same, right? So you've got that, ABD pad or that gauze that you place over the wound, and then the elastic to wrap around it. Just a couple things to remember with an Israeli. Wherever the wound is, make sure you're wrapping above and below the injury. It just holds it in place. Some other things to think about. Anytime you're dealing with a large-scale trauma, maybe consider wearing 2 pairs of gloves from the very beginning. It's much easier to put a glove over a glove than a glove over a sweaty hand. And additionally, you could almost, similar to a hazmat call, do a clean man, dirty man scenario within your crew. Only because if I have blood on my gloves, opening these smooth plastic packages can get a little bit difficult. So just something to think about is, maybe setting up a dirty man, clean man type scenario where my hands are clean. I'm going to be the one opening the package and handing it to my partner. And then in addition, in the bag, hopefully we have multiple size rolls of tape, your average 4x4s, hopefully some oral and nasal airways. So that pretty much covers all of our TEMS equipment. Remember that it's available all the time. So let's not just get into the thought process that it's only for an RTF situation or something like that. Anytime you have a large-scale trauma, this is going to be a great bag to bring with you. And in addition to that, depending on the scenario, if you do, if we do end up responding to a school or something like that, nothing says that we have to only bring this bag. We could bring the PEDS bag, or we could raid the ambulance for all the pediatric-sized equipment or extra equipment. If it looks like we have far more patients than we have equipment, remember, just incorporate this. It's not an either-or scenario. So thanks for listening, and we'll see you at training.